Nutrition science, vitamin E, vitamin C, and selenium. Vitamin E. When we talk about vitamin E, we're actually referring to chemically similar substances, of which alpha tocopherol appears to be the most potent antioxidant. Because vitamin E is fat soluble, its antioxidant capacity is especially important to lipids, including those in cell membranes and lipoproteins. For example, free radicals can oxidize LDL cholesterol, stealing an electron from it, and it is this damaged LDL that lodges in blood vessels and forms the fatty plaques characteristic of atherosclerosis, increasing the risk of heart attack, stroke, and other complications of cardiovascular disease. After alpha tocopherol interacts with a free radical, it is no longer capable of acting as an antioxidant unless it is enzymatically regenerated. Vitamin C helps to regenerate some of the alpha tocopherol, but the remainder is eliminated from the body. Therefore, to maintain vitamin E levels, you ingest it as part of your diet. In addition to its antioxidant functions, vitamin E, mainly as alpha tocopherol, plays a role in the immune system, regulation of gene expression, and cell signaling. It also enhances the dilation of blood vessels and inhibits blood clot formation. Some food sources of vitamin E. Excellent dietary sources of vitamin E include nuts, seeds, and vegetable oils, with additional amounts provided by green leafy vegetables and fortified cereals. Surveys of Americans' diets often find that they provide less than the RDA for vitamin E. However, these studies may underestimate the amount of vitamin E in the diet because they don't fully account for vegetable oils in the diet, as these are rich sources of vitamin E. Vitamin E can be destroyed at high temperatures, especially when reheated repeatedly. So oils used in deep frying are not good sources of the vitamin. Vitamin E deficiency and toxicity. Outright vitamin E deficiency with obvious deficiency symptoms is very rare in healthy people. It most often occurs in people with an underlying disorder that impairs the digestion and absorption of fat. Symptoms of vitamin E deficiency include nerve and muscle damage, vision problems, and a weakened immune system. Studies have not found any risks of consuming vitamin E in foods. The upper limit for vitamin E is set at 1,000 milligrams for adults, far above the RDA of 15 milligrams and far higher than could naturally be obtained from food. These amounts are available in supplement form. However, as mentioned, high-dose vitamin E supplements were shown to increase the risk of prostate cancer in men. Other studies have found that high-dose vitamin E supplements are associated with an increased risk of hemorrhage, stroke, and death. Vitamin C. Vitamin C, also called ascorbic acid, is a water-soluble vitamin essential in the diet for humans. Interestingly, most other mammals can readily synthesize vitamin C and don't require it in their diets. Vitamin C's ability to easily donate electrons makes it a highly effective antioxidant. Since it is water-soluble, it acts both inside and outside cells to protect molecules in aqueous environments. Vitamin C also plays a vital role in regenerating vitamin E after it has acted as an antioxidant, allowing it to be recycled and used again. In addition to its role as an antioxidant, vitamin C is a required part of several enzymes involved in the synthesis of collagen, a protein important to the strength and structure of muscles, bones, tendons, ligaments, connective tissue, and skin. Vitamin C is also required to synthesize neurotransmitters, important for signaling in the brain, some hormones, and amino acids. It also plays a role in immune function and improves the absorption of dietary iron. The body's vitamin C status is tightly controlled to maintain steady tissue and plasma concentrations. This means that if you consume high doses of vitamin C, you'll absorb less from the intestine and excrete more in urine to prevent excessive concentrations in the body. Vitamin C is not stored in any significant amount in the body, but once it has reduced a free radical, it is very effectively regenerated and therefore can exist in the body as a functioning antioxidant for many weeks. Food sources of vitamin C. Fruits and vegetables are great sources of vitamin C. Some of the best sources include bell pepper, citrus, broccoli, strawberries, Brussels sprouts, and cantaloupe. Because vitamin C is water soluble, it leaches away from foods considerably during cooking, freezing, thawing, and canning. Up to 50% of vitamin C can be boiled away. Therefore, eating fruits and vegetables raw or lightly steamed maximizes the vitamin C value of these foods. Vitamin C deficiency and toxicity. The classic condition caused by vitamin C deficiency is scurvy. The signs and symptoms of scurvy include skin disorders, bleeding gums, joint pain, and weakness, all of which may be related to vitamin C's role in collagen synthesis. Additional symptoms of scurvy include abnormally thickened skin, fatigue, depression, iron deficiency anemia, and increased susceptibility to infections. In the past, scurvy was common among sailors on long ocean voyages whose diets were completely lacking in fruits and vegetables for many months. Experiments revealed that citrus fruits and juices could prevent scurvy in sailors. British sailors were often referred to as limeys, as they carried sacks of limes onto ships to prevent scurvy. It was not until 1932 that scientists showed that vitamin C was the essential nutrient involved in this cure. Scurvy is prevented by even a low intake of fruits and vegetables, and it takes at least a month of consuming very little or no vitamin C for scurvy symptoms to develop. Thus, scurvy is rare in developed countries today. Diet surveys show that most Americans meet the RDA for vitamin C when vitamin C deficiency occurs today. It is in people who consume very limited food variety, such as those with mental illness, people who abuse alcohol or drugs, people on very restrictive diets, and impoverished people with limited fruit and vegetable access. People who smoke also require more vitamin C to counter the free radicals generated by smoking. The risk of vitamin C toxicity from foods is essentially non-existent because the body can adjust intestinal absorption and urinary excretion to maintain a healthy vitamin C level. However, high doses of vitamin C from supplements have been reported to cause numerous problems, including gastrointestinal upset and diarrhea. To prevent these discomforts, the upper limit for vitamin C is set at 2,000 milligrams per day for adults and more than 20 times the RDA. At very high doses, in combination with iron, vitamin C has sometimes been found to increase oxidative stress, reaffirming that getting your antioxidants from foods is better than getting them from supplements. There is also some evidence that taking vitamin C supplements at high doses increases the likelihood of developing kidney stones. However, this effect is most often observed in people that already have multiple risk factors for kidney stones. Can vitamin C supplements prevent the common cold? Many people believe that taking a vitamin C supplement can prevent the common cold or decrease its symptoms. This idea was popularized by Linus Pauling in the 1970s and is continuously promoted today in the form of over-the-counter supplements.